Stop what you are doing. Look at your hand. Do you have a small white or colored tablet sitting there, ready to take? Is that tablet ibuprofen or perhaps naproxen? If your daily routine involves reaching for that pill bottle 4 times a day, morning, noon, dinner, and before bed, because your knee aches, your back is stiff, or your arthritis is flaring up, then this message is the most important health warning you will hear this year. This is not about an accidental overdose. This is about a silent, daily accumulation of risk that millions of Americans over 60 are unintentionally committing against their own body, believing they are managing their pain safely. We are talking about medication you can buy anywhere, the corner store, the grocery aisle. It feels safe because it does not require a doctor's note, but that very accessibility hides a profound danger for your long-term health. A danger focused specifically on your kidneys. Your kidneys are your body's quiet heroes. They filter waste, balance fluids, and clean your blood, doing all this silently, 24 hours a day. When they start failing, they rarely send a loud alarm. They whisper first, and that whisper can easily be mistaken for just getting older. We are focusing today on a group of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs. Ibuprofen, like Advil or Motrin, and Naproxen, like Aleve, are the most common members of this family. They are miracle workers for inflammation and acute pain. They get you through that golf game, help you finish the gardening, or let you manage that post-op discomfort. The problem starts when the short-term fix becomes the long-term routine, when taking the edge off becomes essential just to get out of bed. Think about your pattern right now. Do you take 600 mg of ibuprofen in the morning, another 400 ml after lunch, another dose before dinner to make it through the evening, maybe a final dose before you try to sleep? If you are consistently taking the maximum daily recommended dose, or even slightly less every single day for months or years, you are actively interrupting the complex mechanism your kidneys use to survive. Let me explain this simply. Your kidneys are extremely hardworking. They need a high, steady blood pressure inside their filtering units to do their job properly. When you take an NSAID, it travels through your body, reducing pain and inflammation. But it also interferes with the signals that tell the blood vessels around your kidneys to dilate and maintain that perfect high internal pressure. When you take a pill occasionally, your body handles the temporary stress. But when you are taking NSAIDs 4 times a day, every day, you are forcing your kidneys to work under constant duress. It is like asking a car engine to run continuously on low oil. It might work for a while, but the damage is guaranteed to build up silently. This consistent interference leads to a condition called chronic kidney disease, or CKD. It is insidious because you won't feel kidney pain until the damage is severe. You might just feel tired, or notice your ankles swelling, or think you are drinking enough water when you actually are not. For people over 60, the risk jumps significantly. Why? Because as we age, our kidney function naturally declines, even if we are perfectly healthy. That natural decline leaves far less margin for error. What was safe for you at 40 is dangerous at 65. The danger of daily NSAID use is compounded if you also have other very common conditions like high blood pressure or diabetes. These conditions already put a massive strain on your kidneys. Adding a high daily dose of ibuprofen on top of that existing stress is a direct path to serious renal damage and, eventually, the potential need for dialysis. But there is immediate protection. There is immediate action you can take to stop this silent process today. The first step is moving from habit to awareness. You must stop treating these drugs like vitamins and start treating them like the powerful, potentially toxic medication they are in high doses. If your pain requires consistent, daily dosing just to function, that is a medical flag, not a minor inconvenience. It means the root cause of your pain has moved beyond simple management and needs a conversation with a specialist about alternatives. Do not wait for your annual physical. The damage is cumulative and the clock is running now. To protect yourself immediately, you need to know exactly how much danger you are already in. That starts with identifying the subtle physical warning signs your body is already sending you. In the next part, we will discuss the three most common, easily missed red flags of kidney distress that seniors frequently dismiss as simple aging or fatigue. If you see even one of these signs, you must call your doctor tomorrow. Let's get specific now. We need to talk about exactly how this silent damage happens. We are focusing on a specific class of common medications called NSAIDs, non-steroidal anti-inflammatory drugs. Ibuprofen, sold commonly as Advil or Motrin, is the primary culprit in overdose situations. But this warning applies just as strongly to Naproxen, which you know is Aleve. These drugs are powerful helpers. They dramatically reduce inflammation. They take the edge off joint pain and muscle aches quickly. But for your body, this quick relief comes with a high cost, specifically for your two vital filters. Think of your kidneys as the most complex water treatment plant in the world. They filter every drop of blood in your body multiple times a day. To perform this massive cleaning job, they require constant high-pressure water flow, meaning strong, consistent blood pressure. NSAIDs work by affecting specific chemicals called prostaglandins. Prostaglandins usually act as messengers telling the tiny blood vessels in your kidneys to stay open and wide. This ensures high blood pressure and flow into the filters. When you take an NSAID, it blocks these messengers. It stops the inflammation, but it also causes the necessary blood vessels in your kidneys to tighten up. It is like turning down the water valve to the treatment plant while the waste keeps pouring in. If this happens once or twice, your body is resilient. It recovers quickly. But if you are taking that pill 4 times a day, every single day, the tiny blood vessels are chronically constricted. The stress never stops. The constant low blood flow slowly starves your filtering units. This is why the danger is silent. You cannot feel the blood vessels tightening. You don't feel kidney damage like you feel a sharp knee pain. The deterioration happens slowly, unnoticed, until too much function is lost. Now, let's identify the 3 most common silent traps that cause seniors to unintentionally hit dangerous NSAID dosage limits. You need to watch out for these traps starting today. Silent trap number 1, the different bottle illusion. You are managing chronic arthritis pain in your hips. Your doctor gave you a specific dosage of ibuprofen to take up to 3 times a day. You follow this perfectly. Later in the week, you develop a bad tension headache. You open your cabinet and see a bottle labeled maximum strength headache relief. Because it is a different bottle, you assume it is a different medication. Wait. Stop right there. Many common headache relief or fever reducer products are simply repackaged ibuprofen, sometimes at an even higher single dose. You just took 2 full doses of the exact same chemical, disguised as 2 different problems. This is accidental doubling, and it happens every day in senior households. You must become a label detective. Look past the brand name and look only at the active ingredient. If the active ingredient says ibuprofen or naproxen, that pill counts against your daily limit, no matter what color the box is. Manurt's silent trap. Number 2, the cold and flu cocktail. This is perhaps the most dangerous trap, especially during winter months. You catch a nasty cold. You take a daytime decongestant for your sinus pressure. Then you take a specific nighttime cold and flu medicine to help you sleep. Most multi-symptom cold and flu relief formulas contain an NSAID, either ibuprofen or naproxen, to address the common body aches and fever associated with the flu. You might be taking a high dose of your regular arthritis medication and a full dose hidden inside your cold medicine. You are treating 2 separate issues with 2 separate bottles, but chemically, you are combining 2 full doses of NSAIDs. You have created a chemical collision inside your body that puts immediate and severe stress on your kidneys. Before you buy any over-the-counter cold remedy, flip the package over and read the drug facts label. If it lists acetaminophen, that is Tylenol, which is safer for your kidneys, but still requires care. If it lists ibuprofen or naproxen, subtract that dose immediately from your daily pain budget. Chopper silent trap. Number 3, the as-needed time. Warp. This trap involves poor tracking of the clock. Your doctor prescribes the NSAID as needed for pain. This sounds flexible, but the definition of as needed is strictly tied to a 24-hour cycle. Ibuprofen, for example, is generally meant to be taken every 6 to 8 hours. If you take a dose at 8 a.m. for your knee pain and then your back flares up at 1 p.m., you may decide you need another dose right away. You are feeling the pain, so it feels needed, but you have drastically shortened the required time gap. Then, you take a third dose right before bed at 9 p.m. to ensure a good night's sleep. You have squeezed 3 or 4 doses into a 13-hour window. The total cumulative amount you take within 24 hours is the only metric that matters to your kidneys. You might feel relief in the short term, but you are creating a cycle of high exposure that your kidneys cannot escape. Remember, the true risk is not taking one pill. The true risk is chronic high-dose exposure, 4 times a day, every day, for months or years. This slow, steady pressure is what chips away at your ability to filter waste. To protect yourself, you need to know exactly what to look for when your filters start failing. The warning signs are often subtle. They are easy to dismiss as just being part of getting older. In our next segment, we will reveal the specific physical symptoms you must watch for. These are the immediate red flags your body throws up when your NSAID usage is attacking your kidneys. Knowing these signs can help you stop the damage before it becomes irreversible. But the danger doesn't always come in a bottle labeled ibuprofen. We need to talk about the hidden traps. Many people think they only take one NSAID, but they are secretly taking 3. This is one of the fastest routes to overwhelming your kidneys. You must become a label detective starting today. Think about the cold medicine you bought last winter. That pill for sinus headaches. The nighttime flu remedy that helped you sleep. Many combination cold, flu, and allergy medications contain a hidden NSAID like ibuprofen or naproxen, often combined with acetaminophen and a decongestant. If you take 2 ibuprofen tablets for your arthritis and then take a popular cold medicine because your nose is stuffy, you have potentially tripled your daily dose without realizing it. Stop and check your medicine cabinet right now. Look at the active ingredients list on every single bottle that claims to relieve pain, fever, or inflammation. If you see ibuprofen, naproxen sodium, or ketoprofen listed anywhere, add that dosage to your daily count. This cumulative damage is silent. It feels harmless because you are simply treating different symptoms. But your kidneys only track the total dose of the drug, not the reason you took it. You are the first and final line of defense against this accidental overdose. This brings us to the most crucial, non-negotiable step in protecting your kidney health, your conversation with your doctor. When you go in for your next appointment, you must be completely honest about your pain relief history. Do not downplay your use. Do not say, "I just take a few sometimes." Your doctor needs to know the specific numbers. I averaged 4 ibuprofen a day for the last 6 months. This detail changes the entire risk assessment. Ask for specific kidney function tests. While a general blood panel is helpful, you need to know your creatinine levels and your estimated glomerular filtration rate, the GFR. The GFR number is the gold standard. It measures how effectively your kidneys are filtering waste from your blood. Think of it as the kidney's efficiency score. A GFR below 60 is a significant red flag that requires immediate review of your medication regimen. Insist on knowing this number, write it down, monitor it every year. This GFR score is not just a laboratory result, it is the early warning system that protects you from chronic kidney disease. Now, let's look at reducing the daily load on your system. We need effective pain relief that bypasses the NSAID mechanism. The most common alternative is acetaminophen, commonly known by brand names like Tylenol. Acetaminophen does not carry the same immediate kidney danger as ibuprofen, but it carries a significant risk to your liver. For seniors, especially those over 65 or those who consume even moderate amounts of alcohol, the maximum safe daily dose of acetaminophen must be carefully restricted. Do not follow the directions on the bottle designed for a healthy 30-year-old. The standard maximum dose is often listed as 4,000 milligrams per 24 hours. For seniors, especially those with existing health issues, the recommended maximum should often be closer to 2,000 or 3,000 milligrams. Never exceed 3,000 milligrams unless specifically directed by your physician. Liver damage from acetaminophen overdose is extremely serious and often irreversible. If you use this alternative, you must be meticulous about tracking every dose. Another incredibly effective approach is to treat pain locally, avoiding the need for the drug to travel through your entire circulatory system and kidneys. We are talking about topical pain relief. Creams, patches, and gels containing ingredients like menthol, lidocaine, or topical forms of NSAIDs can provide relief exactly where you need it, often using only a tiny fraction of the dose you would take orally. Think of it this way. Rubbing the gel directly onto your sore knee delivers medicine to the joint without forcing your entire body, including your sensitive kidneys, to process a massive systemic dose meant to treat everything from a headache to a sprained ankle. This targeted approach dramatically reduces the risk of kidney damage. You should also explore non-pharmacological methods immediately. Heat and cold therapy are your allies. A simple heating pad can relax muscle spasms and reduce joint stiffness as effectively as the first dose of a pain reliever. Ice therapy, applied immediately after acute pain or strain, can dramatically reduce the inflammation cycle before it starts demanding chemical intervention. The goal is simple. Create space between the moment you feel pain and the moment you reach for a pill. The wider that gap, the healthier your kidneys remain. One final critical adjustment involves the simple act of drinking water, especially when you are taking an NSAID. As we discussed, NSAIDs trick the kidneys into restricting blood flow. Hydration is the only factor that actively fights this restriction. You must increase your water intake significantly, particularly during high-dose pain relief periods, like recovering from surgery or managing a flare-up. But don't just drink water when you feel thirsty. Thirst is already a sign that your body is mildly dehydrated. Aim for small, consistent doses of water throughout the day. Set an alarm to drink a glass every hour. If you are using NSAIDs, make sure your fluids are truly hydrating. Coffee, high-sugar sodas, and alcohol are diuretics. They draw water out of your system. Taking ibuprofen with coffee is counterproductive to kidney protection. You are pouring gas on the fire. For every diuretic drink you consume while on NSAIDs, add an extra glass of plain water to compensate. This combination of vigilance, checking labels, talking openly with your doctor, restricting maximum dosages, and rigorous hydration forms the immediate defense strategy against silent kidney failure. But there is one major question we have not addressed yet. How long is too long? When does short-term relief become chronic, irreversible danger? In our final segment, we will define the critical window of risk and discuss the specific signs that your kidneys are already signaling distress, so you know exactly what warning signs to never ignore. We have covered the silent dangers of overuse. Now, let's focus entirely on protection. What do you do when the pain flares up but you need to protect your kidneys? We must break the automatic habit of reaching for the ibuprofen bottle. First, assess the type of pain. Is it a deep, immediate inflammation, or is it generalized soreness? If you must use medicine, consider acetaminophen first. This is Tylenol. Acetaminophen is not an NSAID. It avoids the kidney pressure problem. But listen closely. Acetaminophen is not safer if you ignore the dose. The danger shifts to the liver. Never exceed 3,000 milligrams in a 24-hour period. If you drink alcohol regularly, you must reduce that dose significantly. Consult your pharmacist today. Remember, the first line of defense is not a pill. Try topical treatments first. Look for creams, patches, and gels containing lidocaine or diclofenac. These delivers relief directly to the painful spot. They target the area without stressing the entire filtering system. For chronic joint pain, physical therapy is often the best long-term medicine. Low-impact movement strengthens the joint and reduces the reliance on pills. A simple heating pad or an ice pack can provide immense zero-risk relief. Your kidneys will thank you for choosing the heat pad over the pill. The critical element, hydration. Kidney protection boils down to one simple critical rule: hydration. Water is the engine coolant for your kidneys. When you take any NSAID, your kidneys require extra water to manage the intense filtration process. If you are dehydrated, the concentrated dose of the drug hits your filtering units much harder. This is often the immediate trigger for acute kidney injury. How much water do you need? A good baseline for seniors is 6 to 8 glasses of water daily. This is critical. Do not wait until you feel thirsty. Thirst is a late signal. By the time you feel it, your body is already struggling to maintain adequate fluid balance. Keep a designated water bottle beside your chair. Sip continuously throughout the morning and afternoon. Avoid excessive consumption of caffeine and alcohol when you are using NSAIDs, even occasionally. These are diuretics. They push water out of your system, compounding the dehydration risk. Your goal is to keep your urine pale yellow, almost clear. This indicates safety. The empowering conversation with your doctor. The most powerful step you can take today is scheduling an honest conversation with your primary care physician. You must become an active, informed protector of your own health. Do not assume your doctor knows every over-the-counter medicine, supplement, or cream you use. This gap in information is often where danger enters the system. Write down every single thing you consume. Take that comprehensive list to your next appointment. Ask this specific protective question. Doctor, given my age, my blood pressure, and my history, is ibuprofen safe for me to use, even occasionally? Specifically, request a kidney function test. This is usually a simple blood draw known as a comprehensive metabolic panel, or CMP. The CMP checks two crucial numbers, creatinine and GFR. GFR stands for glomerular filtration rate. These numbers tell the silent story of your kidney health. If your GFR is below 60, regular use of ibuprofen must stop immediately. Your doctor must know this. Your physician needs to review all your prescription medications, especially blood pressure drugs and diuretics, in light of your potential NSAID use. Certain combinations are known to be profoundly toxic to the kidneys. Be proactive. Vadidar, your final protective action plan. We started this journey by focusing on avoiding silent danger. We close with your immediate protective action plan. Memorize these 5 rules. They are the keys to long-term kidney protection. Rule 1. Never dose NSAIDs automatically. Always pause and question the pain before you reach for the bottle. Use non-drug methods first. Rule 2. Stop counting pills by the day. Count them by the week. If you take ibuprofen for more than 3 days in a row, you are putting your kidneys under immeasurable immediate stress. This is the danger zone. Rule 3. Always start with the lowest effective dose. Do not immediately reach for 2 pills. Start with 1. Wait an hour. Often, 1 is enough. Rule 4. Hydrate aggressively whenever you use any pain reliever. Water is the required antidote that minimizes systemic pressure. Rule 5. If you have high blood pressure, diabetes, or are over the age of 75, treat NSAIDs like controlled prescription narcotics. Use them rarely and only after consulting with your doctor first. Your comfort is important. Your long-term health is priceless. The silent danger of ibuprofen overuse is real. But armed with this specific actionable knowledge, you can stop the threat today. Take control of your medicine cabinet. Make the safe choice.